Congratulations, you have made it. The morning sickness is hopefully fading. Your energy is coming back, and suddenly you're beginning to look pregnant. Welcome to the golden phase of pregnancy, the second trimester. But why this phase is famous for the glow, it is also the time of the most rapid brain development, the very first kick, and some of the weirdest symptoms you haven't been warned about just yet. Over the next 30 minutes, we are going through pregnancy week by week, from week 13 to week 27. We're going to look inside the womb with 3D renders. You get to find out what is happening to your body, the second trimester symptoms and what they mean. You find out the key red flags you need to watch out for and report them promptly. You get to find out when you feel the very first baby kick. I'll equally share the one milestone in week 20 that changes everything. You equally get to know the important medical tests that are a must do for a healthy pregnancy for both mother and child. And lastly, I'm going to share one practical habit that helps you prepare your body for breastfeeding, such that by the time you deliver or shortly before delivery, your milk is ready to flow, especially if exclusive breastfeeding is your goal, not milk coming in 1 to 2 days after delivery. But before we start, my name is MLS Nonya. Welcome back to Good Life Medics on YouTube. If you're new here, we'll share all things pregnancy, baby developmental tips, and everything women's wellness. It doesn't matter whether you are in United Kingdom, US, Asia, Africa, or anywhere else, the science is clear. So click that subscribe button and turn on that bell so you don't miss any of our weekly uploads. So real quickly, let's start from where most women think the easy part begins, because understanding this phase is not optional. It is actually essential. And please don't skip week 27, because I'm going to reveal everything you need to know about the viability milestone that makes the biggest difference for your baby. The second trimester starts from week 13 up to the end of week 27. This is the bridge between the hidden pregnancy of the first trimester and the heavy reality of the third. This is where bonding truly begins, because for the first time, your baby can now hear you. So, week 13, here your baby is about the size of a lemon and measures between 8 cm and 8.5 cm. Their vocal cords are forming, and now placenta has taken over hormone production. That is why many moms feel that energy surge, nausea and early morning sickness might improve, and appetite returns. Also, the pregnancy glow begins because increased blood flow means more radiant and glowy skin, and might also mean more stuffy nose. Please start learning how to sleep on your sides by now so that you can get used to it. Week 14, facial expressions. This is where things start to get really fascinating. Your baby is practicing expressions. Tiny facial muscles are developing, allowing them to squint, frown, grimace, and practice early sucking movements. They are learning how to use muscles that will allow them, or that will help them with feeding, communication, and breathing when they are born. Here is the part that most moms don't realize. All these small expressions are your baby's first communication signals and signs that your baby's nervous system is developing healthy. If you think that's impressive, wait until you see what is going on in week 15. Week 15, the senses awake. Here, your baby measures about 11.5 cm long and is about the size of an orange. Now, throughout this journey, it can be hard to visualize what's happening inside of your bone. So, to make this real, we're going to be using the official pregnancy scale. So for every week, I'll be revealing a new fruit or vegetable that matches your baby's size. It's a great way to track their progress, and honestly, a fun excuse to look at your grocery list differently. Keep an eye for week 20, because the fruit we use there marks the biggest growth spot for the entire trimester. So back to week 15. Here, your baby is about the size of an orange. Their skin is still pepper thin, and they are starting to develop taste buds that if you eat spicy foods like garlic, for example, your amniotic fluid might change flavor. Your baby is also now light sensitive, that if you shine a flashlight on your belly, they might move away slightly. Also, their legs are growing and they can now move their limbs. Week 16, the avocado. At week 16, your baby is entering an important phase of rapid growth and development. Their legs and head is becoming more proportionate. Their eyes and ears are settling at positions that resembles the way they will appear at birth. Their heart is growing stronger and pumping more blood. Now, if you gently rub your belly, you might notice tiny movements that is described as flutters, even if you can't feel them just yet. Your body is adapting very well, just the way it should. And trust me, you're going to be a great mom. Also, your uterus rises up into the abdomen. Postures might shift and center of gravity might as well change. This is that time when some women begins to experience some back discomfort, not because something is wrong, but because your body is distributing weight accordingly. Pause with me for 30 seconds. If your hips have been aching lately, this is for you. Practice what I call some hip stretch routines, which I'm going to be dropping for you in the description box. Read them and tell me if they helped you. Let's proceed to week 17. Week 17, the pomegranate. At week 17, your baby begins storing fats to keep them more warm. The nervous system is becoming more active. Movements are becoming more strong, even if you can't feel them just yet. Your body is now balancing higher energy demands, which is why staying hydrated and having consistent meals will matter more than before. Skipping meals at this period is going to affect your blood sugar stability, and this will matter when you be going for your gestational diabetes screening. Week 18, the bell pepper. You are gradually approaching a major checkpoint, and you should be getting ready for your anomaly scan, also called the 20-week scan. Your baby's ears are now in their final positions, and they can now hear your heart beating and your stomach growling. By now, your appetite should be back with a vengeance. We'll be talking about healthy cravings and nutritional needs, because understanding the difference between these two will matter even psychologically. Let me ask, have you felt any baby movement just yet? Though at this stage they are still called quickening or flutters. Let me know, at what week did you feel your very first baby movement? Let me know in the comment section. Week 19, the protective shield. At pregnancy week 19, your baby is about 15.3 cm long from head to bottom, which is about the size of a heirloom tomato. Here, your baby is developing a protective shield called the venous caseosa. You know all those white waxy cotton you see on some babies, even some newborns, even at birth. It is called venous caseosa, and this prevents their bodies from being pickled or dried out inside of the amniotic fluid which your baby is in. Okay, and by now your uterus should be just below your belly button, and movement is supposed to be stronger by now. Week 20, congratulations my lady. At this point, you have successfully carried your pregnancy halfway. It's not easy, or is it? It's not. At this point, your baby is about 25.6 cm long, which is about the size of a banana from head to heel. This is the time to go for your anomaly scan. An anomaly scan is a detailed ultrasound performed by a trained medical radiologist or sonographer. It is usually performed between week 18 and week 22 to evaluate your baby's growth and development. It checks for about 11 different conditions in your baby, evaluating or examining organs like the heart, the kidney, the brain, and checking for conditions such as cleft lip and palate, checks for spinal bifida, checks for certain chromosomal or genetic conditions like Down syndrome, for example, and assesses both the placenta and amniotic fluid. It just allows early detection of issues, allowing for preparation of birth, further tests, and helps your healthcare providers plan for any necessary or specialized treatment or surgery where need be. But most times the test comes back normal. But when something is detected early, that is before birth, outcomes are usually better. This scan is not a verdict, it's a roadmap and allows you to move wisely. During this scan, you can as well request for the sex of your baby to be revealed to you. That is, if the hospital policy allows that, and if the position at which your baby is in at that point in time will allow for clear view. If not, you might be asked for a follow-up scan in 2 weeks' time. Let us now enter into month 6, which is between week 21 and week 24. During this month, your baby is going to be attaining a new great milestone that will actually bring you so much relief. So let's head into week 21. Week 21. By week 21, your baby now measures about 26.7 cm from head to toe, which is about the size of a carrot. Here, your babies can now test what you eat because their test buds are working. Studies have shown that babies who tested a variety of flavors while still in the womb are often less picky eaters. So, eat that your broccoli now if you would want them to like it later. So tell me, which food have you been craving lately? Let me know. Is your baby a spicy taco fan or a chocolate lover? Let me know in the comments, okay? By week 21, you can now feel clear baby movements. These baby movements are not just kicks, they are actually neurological milestones. This is also the best time you should begin bonding with your bond because connections actually begin long before birth. I explained this in so much details in that video about healthy habits, how it affects your baby's brain development in an amazing way. Please, I'm going to put the link to that video in the description because you need to understand what this bonding does to your baby's brain development. Let's head over straight to week 22. Week 22, your baby now measures about 27.8 cm from head to toe, and that is about the size of a sweet potato. Your baby's lungs are developing and they are now practicing how to breathe. They are swallowing small amniotic fluids, which will later come out after birth as that first black baby poo called meconium. On your body, you might notice stretch marks coming out. Don't worry, they will most likely fade after birth. But that is why I always say, even in my previous videos, for you not to use any harsh beauty products that might subject your body to more stretches because naturally pregnancy comes with some amount of stretches. So continue using mild beauty products, both creams, soaps, and all of that. Do not introduce any new products that you don't know whether they might be pregnancy friendly, and ensure you go through the ingredients, the description of the one you're using, and ensure they do not have harsh chemicals that might affect your baby. Ingredients like mercury, hydroquinone, some of them are not pregnancy and baby friendly. So if you're using such products, please take them off your skincare routine, especially now that you're pregnant. Week 23, your baby right now is about 28.9 cm long, and that's about the size of a grapefruit. Their body might look saggy for now because they haven't yet filled them up with fat. Some people say they might still be looking like little old men. You might also notice mild swelling of the feet. If you experience this, just raise your legs up a little bit, just maybe above your heart level for up to 20 minutes a day. Don't worry, I'll be explaining more on these symptoms in the symptom segment, so stay tuned. Week 24, the viability milestone. Right now, your baby measures about 30 cm long from head to heel, and that is about the size of the ear of a coin. Your baby now attains the viability milestone, which means that if born now, the baby has a chance of survival in the neonatal and intensive care unit with the right kind of support and care. Majorly, your baby's lungs is developing surfactants to help them stay open. Week 25, fat and temperature control. Here, your baby is adding up fat, not just for cuteness, but also for survival and to smoothen out the wrinkles. Here, sleeping might become a little harder for you, and that is where pregnancy pillows become lifesavers. They are very handy. If you find it difficult sleeping at this stage, please get yourself a cute pregnancy pillow. All those U-shaped pillows, they are actually lifesavers. Week 26, the eyes open. For the first time, your baby can now open their eyes. Babies perceive light through the belly wall, and if you shine a soft light on the belly, your baby can respond with a soft movement. If you have a negative blood type, like an O negative, B negative, A negative, or even an AB negative, during this time, week 26 or week 27, you most likely receive a Rogam injection. This Rogam will prevent your body, your maternal blood cells, from producing antibodies that will attack the baby's blood cells. This is actually a marvel of modern medicine, and it will help you a whole lot if you have a rhesus negative blood type. Week 27, the hiccups and transition. Those rhythmic taps you feel, that is hiccups for you. It is a sign that the diaphragm is developing perfectly. Congratulations, you just concluded your second trimester of pregnancy. And by the end of the second trimester, your baby is already very active, strong, and growing really fast. But here is something many people don't know. A pregnancy can look perfectly fine on the outside, while important changes are going on in the inside. That is why second trimester is not just a time of watching your bump grow. It is also a time of checking, confirming, and protecting that growth. In the next few minutes, I'm going to walk you through the most important medical tests of the second trimester. I will tell you what they check, why they matter, and which ones can catch problems early before they become complications in the third trimester. Some of these tests don't check your baby at all. They check you, and they can quietly prevent complications. And because these tests are so vital and deserves our undivided and maximum attention, I've decided to dedicate an entirely separate video just to talk about these life-saving important screenings. Think of it as your second trimester safety net. It will be coming out as a part 2 of this particular series, and you don't want to miss it. But before you go, if you found this video helpful, if you found it informative, tap the like button and consider subscribing. Equally turn on the notification bell so that you don't miss any of our weekly uploads. Let me know in the comment section which week of pregnancy are you currently in. I would love to celebrate your progress with you. And until then, take care of your body, listen to your body, pay close attention to everything you experience. If possible, make a list and always note them down so that anytime you're in your doctor's office, you wouldn't be forgetting your question. And I will see you in the next one. Thank you for watching.